Welcome to the deep dive. Today, we're tackling something, well, vital to all of us, the intricate workings of our heart and blood vessels. The cardiovascular system.
Mhm.
And we've got some interesting material here. A listener sent in a YouTube video by someone called Ojimaki. The title is Acho, Asha, Ashaha.
Right, which translates roughly from Russian to the work of the heart and blood vessels, what determines their health and longevity.
Exactly. So our mission today.
Our goal really is to dig into this video, pull out the key insights about how this whole system functions, and maybe more importantly, what the video suggests influences its health. We want to understand the connection it draws between the heart, vessels, and other body parts.
And, what really jumped out at me right away was this strong focus on muscles,
Yeah,
specifically leg muscles and the diaphragm. It's a perspective that, well, maybe doesn't always get the spotlight in typical heart health discussions.
definitely an interesting angle. So the video kind of starts with the basics, right?
Mm-hmm.
Reminding us that the heart and the blood vessels, they're one unit, the cardiovascular system.
Yes. And it points out how medicine often treats it that way. Like when you get your blood pressure checked in your arm.
That single reading.
Yeah, that reading tells doctors about potential hypertension or ischemia conditions affecting the whole system. So it shows we kind of inherently see them as connected.
That's a good illustration.
Yeah.
And the video emphasizes that, okay, the heart's central, obviously, but it absolutely depends on blood getting back to it through those vessels. It's a closed loop.
Can't pump what it doesn't receive.
Precisely. The video describes the heart, as this powerful muscle.
Mm.
The myocardium, especially in the left ventricle, does the main work.
Right.
But here's a key point from the video. How much blood actually gets back to the right atrium, the top right chamber, that really dictates how effectively the heart can pump. Input determines output, essentially.
Okay, and this leads into something the video calls the peripheral heart. That's not a standard medical term I hear often.
No, it's not. And what's interesting is how the video defines it. It's talking about our skeletal muscles, think legs, your abs, and importantly, the diaphragm.
The breathing muscle.
Exactly, that big muscle under your lungs. The video argues these muscles play a huge, maybe underestimated role in pumping blood back towards the heart.
So like secondary hearts almost, helper pumps.
Kinda, yeah. That's the idea presented. And the video suggests, maybe cardiologists don't always look at skeletal muscles quite this way in terms of their direct pumping assistance.
That's fascinating. The video even dives into how muscles aren't just tissue, but complex organs themselves, right, with their own blood vessels, nerves.
That's an important detail it highlights. Each muscle helps move blood locally, but collectively, especially the lower body muscles and the diaphragm, their action is critical for pushing blood back up against gravity.
Okay, let's visualize this. So the left ventricle pumps blood out into the aorta.
Right, the big artery.
The video says maybe a third goes up to the head, makes sense, but most goes down.
Yep, down towards the legs. Gravity helps there.
So how does it get back up? That seems like the hard part.
And that's where this peripheral heart concept comes in strong. The video explains it's the contraction and relaxation of your calf muscles, thigh muscles, pelvic muscles. They squeeze the veins.
Pushing the blood along.
Exactly. And the diaphragm's movement during breathing adds another layer of assistance. The video really stresses that the speed and volume of this return flow are directly tied to how healthy and active these leg, abdominal, and even back muscles are.
Because those muscles have their own vascular networks, too.
Precisely. It talks about kinetic chains, leg, abdomen, heart.
Ah, linking them functionally.
Yeah, showing they all need to work together to properly feed the heart.
Which contrasts sharply with the idea of just resting when you have heart problems.
Right. The video draws that contrast. It looks at the standard approach rest, meds, IV drips, and argues that while these might support a sick heart, they don't necessarily make it healthy by addressing this muscular pump aspect.
It uses that phrase, running away from a heart attack.
Yeah, or cowardly running. The implication being that even slight activity boosts blood flow back to the heart, much more than just lying still.
It makes sense if you think about it.
Well, the video points out that muscles are like, up to 50% of our body mass? If they're working, they represent a huge potential resource for assisting circulation.
A massive pumping capacity, potentially.
And it distinguishes between skeletal muscles, which we consciously control.
We can choose to exercise them.
Right. And the heart muscle, the myocardium, which works automatically but can weaken if the support system, that return flow, isn't adequate.
Okay, you mentioned the diaphragm earlier, but the video seems to give it special attention. Why is it so important?
Yeah, it really highlights the diaphragm, suggesting its role in filling the heart is often kind of overlooked in therapy.
How does it work as a pump?
Well, it's this huge muscle separating the chest and abdomen,
Oh,
right? When you breathe in, it goes down, expands the chest. When you breathe out, it comes back up.
okay.
This up and down movement, the video explains, literally helps pump blood from the abdominal cavity up towards the heart.
So just breathing properly is contributing to circulation.
Significantly.
Mhm.
Proper breathing, involving not just the diaphragm, but also intercostal muscles, back, abs. It's all part of efficiently supplying the heart.
Can you walk through the mechanics again? Inhale versus exhale.
Sure. So inhale, diaphragm descends, chest expands, belly might push out a bit.
Yeah.
Exhale, diaphragm rises, relaxes, contracts, depending on how you view it. Chest contracts, abs pull in.
And the heart sits right on top of the diaphragm.
Pretty much. So that exhale phase, especially the abdominal contraction part, gives a little push, helping the left ventricle eject blood.
Interesting. And the video links this to exercise.
Yes. It mentions that in modern kinesiotherapy, like the kind associated with iritaga, they often emphasize the exhalation phase during exercises. Making that conscious effort helps the heart.
So this peripheral heart isn't just the legs then.
No, it's legs, abdomen, diaphragm, back muscles, even upper limbs, to some extent everything working to move blood, including up to the brain.
The video calls the circulatory system a hologram, a complete loop.
Yeah, implying you can't just look at one part in isolation. You need to consider these muscle groups for true heart health, which, challenges the approach of maybe just prescribing pills without analyzing muscle function.
Right. It implies a potential gap in standard care if muscle function isn't assessed.
Exactly.
So the core message seems to be exercise is key.
Exercise, yes, but crucially the right kind of exercise. The video argues it's necessary to actively pump blood from the legs back up and make the heart healthier, not just rely on medications indefinitely.
And it mentions observations from this kinesiotherapy center.
Yeah, patients with heart issues, high blood pressure, seeing improvements, specifically a drop in diastolic pressure after exercise.
That's the pressure when the heart relaxes and fills, right? So lower is generally better.
Generally, yes. It indicates the left ventricle is relaxing well and getting good blood flow itself. So seeing that decrease after exercise is presented as a very positive sign.
But it's not just go for a run. There's a warning there.
A big one. The video strongly cautions against just randomly starting intense activity. The sequence is apparently vital.
What's the sequence again?
Legs first, then abdomen, then back muscles, and then exercises involving the heart more directly. Plus, coordinating this with breathing rhythm and using appropriate resistance, especially for torso muscles.
How do they figure out the appropriate part?
Well, the video mentions a functional diagnostic system they use at the center to tailor the program, figuring out the right weights, repetitions, all that, for each person.
It also brings up a point about measuring muscle strength.
Right, that unlike BP or temperature, we don't really have standard routine measurements for muscle strength or, maybe more importantly, muscle imbalances or weaknesses.
Which could be affecting the heart without us realizing.
Exactly. The video mentions myofascial diagnostics. They use to pinpoint these muscle issues that might contribute to heart problems. The core idea: engage the muscles correctly, nourish the heart.
And that regeneration point was incredible. People recovering from heart attacks.
Yeah, the claim is pretty striking. Observing patients years after a major heart attack with significant left ventricle damage initially, who show no scar tissue after years of this specific exercise therapy.
Wow. That suggests the heart has more healing potential than maybe we thought.
It certainly challenges the idea of damage always being permanent. And it positions things like stents or bypass surgery as, potentially life-saving interventions for acute crises, but perhaps not the whole long-term solution for underlying health.
Okay, so let's try to summarize the main takeaway from this deep dive into the video's perspective.
I think the core message is really about recognizing and actively engaging our skeletal muscles, especially legs, abs, and crucially the diaphragm. Understanding their role is fundamental for long-term heart health and function.
It's not just the heart acting alone in a vacuum.
Not according to this view, no. The video's call to action is essentially learn to understand your body, help your heart through these muscles through conscious movement, proper breathing, and the right exercise sequence.
It's about taking a more active, whole-body approach.
Exactly. Empowering yourself, really.
So here's something to think about. How might your own daily movements or lack thereof, and even just how you habitually breathe, How might that be directly impacting your cardiovascular health right now? It definitely encourages questioning maybe some conventional wisdom.